Good evening. My name is Joseph Marino. This is a presentation on cranial nerves. Cranial nerves are a set of 12 nerves that originate in the brain. They are part of the peripheral nervous system and have various functions, including sensory and motor activities. These nerves are responsible for transmitting information between the brain and different parts of the body, primarily the head and neck region. Let's get started. There are 12 pairs of cranial nerves which are continuous with the brain and a number from anterior to posterior. According to their attachments in the brain, cranial nerve number one is attached to the cerebral hemispheres. Cranial nerve number two is attached to the cerebrum via the optic chiasm, the hypothalamus. Cranial nerve number three and four to the midbrain. Cranial nerve number five, six, and seven, and eight to the pons. Cranial nerve number 9, 10, 11, and 12 to the medulla. Some of these cranial nerves are purely afferent, which is sensory. Others are entirely efferent, which is motor. And some are mixed. They're both sensory and motor. Now, I want to give you a quick overview on the difference between sensory and efferent and afferent nerves, and the difference between what is sensory and motor. Afferent nerves are sensory nerves. Okay, afferent neurons, also known as sensory neurons, carry signals from sensory receptors such as the skin, the eyes, the ears, the nose, the tongue toward the central nervous system, specifically the brain and the spinal cord. Function: they convert external stimuli like light, smell, taste, touch, and hearing into the electrical impulses into internal electrical impulses. For example, when you touch a hot pan, right? You have sensory afferent neurons. They send information about that stimulus right up the spinal cord to the brain. Afferent neurons in the eye, they gather signals from the light that come through the rods and the cones in the retina. Your taste buds in your tongue, they send sensory information about different tastes to the brain via afferent nerves. Skin detects mechanical stimuli. That's your Pacinius corpuscles and your Meissner's corpuscles. That's touch, pressure, stretch, temperature, excuse me, and afferent neurons that relay these signals to the brain. Then you have efferent neurons, which is your motor neurons. Efferent neurons also, okay, they carry also signals away from the central nervous system to affect their organs, such as muscles, glands, organs, to initiate, these actions from the stimuli. Their function, excuse me, is for them to transmit commands from the brain to various body parts. For example, when you decide to put your hand away from that hot stove, motor efferent neurons convey this motion command to the muscles. This is done in milliseconds. Efferent neurons, they control muscle contractions. Okay, gland secretions like saliva and other bodily functions like digestion. Okay, essentially, efferent signals are like outgoing messages from the brain to the rest of the body. Let's delve into a detailed overview of each cranial nerve. Now you have olfactory nerve, which is cranial nerve number one. Its function is to smell. Okay, the pathway, it passes through the cribriform plate of the ethmoid bone from the nasal mucosa to the olfactory bulb. Okay, you have the optic nerve, which is cranial nerve number two. Sensory for vision. Okay, its nerve, it rises from ganglion cells to the retina. Okay, and they pass through the optic foramen. Okay, it goes through the optic canal. Okay, at the hypothalamus, okay, there's two nerves that cross, forming the optic chiasm. The oculomotor nerve, which is cranial nerve number three, motor. To these muscles help the eye movement, help the superior oblique and lateral rectus muscles. It also innervates the levator palpebrae superior muscles, which help elevate the eyelids. The sphincter pupillary muscles are good for pupillary constriction and accommodation. Okay, which is good in aiding the ciliary muscles. It also passes through this superior orbital fissure, and damage to this cranial nerve can result in something called ptosis, which would be drooping of the eyelid. Okay, then you have trochlear nerve. Okay, that's cranial nerve number four. Now that's motor. Now to the superior oblique muscle of the eyeball, it innervates. It passes through the superior orbital fissure. It's the smallest cranial nerve, and it's the only cranial nerve to emerge from the dorsal side of the brain. It's the dorsal side of the brain, and so also has the longest pathway. Because of its small size and long path, it is vulnerable to head injury or surgical injury, which can result in loss of function of the superior oblique muscle, which would limit the ability to looking down and outward. Okay, that would be like an inferolateral ocular movement, like down and outward. Okay, and my head winds up going with my eyes. Excuse me. It's a natural progression. Trigeminal nerve, cranial. Excuse me, cranial nerve number five. That's mixed. It's motor and sensory. Motor for the muscles of mastication. Sensory from the face. Now you have three branches for sensory from the face. You have the ophthalmic, the maxillary, and the mandibular. It's the largest cranial nerve. Okay, you have the ophthalmic branch for sensory from the superior part of your face. You have your eyeball, your lacrimal gland, your conjunctiva, your nasal mucosa, your scalp, your skin, your forehead, your upper eyelid, and your nose. This branch passes through the superior orbital fissure. Then you have maxillary branch. That passes through the foramen rotundum, which supplies the bottom of the nose, the skin, the maxilla, the upper teeth, and the gums. Then you have the mandibular branch, what passes through the foramen ovale. It supplies the skin over the mandible and the lower teeth or the gums. Okay. Now, for instance, when you have dental caries, cavities, and you go to the dentist, you tell them I'm in pain. Okay, these mandibular branches, they have to inject during dental work before they do any work. They got to inject an anesthetic into them. Okay, that would be, to help block the sensation. As we mentioned in weeks prior to this course, they would use lidocaine, and that would help to block the innervation stimulus of the pain from the nerve. Okay, and from the cavity. You have abducens nerve. That's cranial nerve number six. That's that's motor. Yeah, okay, that controls the lateral rectus muscle of the eyeball, which allows the eye to adduct. Okay. That's to look away. It passes through the superior orbital fissure. Okay, injury to this nerve will result in difficulty in rotating the eyeball outward and will produce diplopia, which is a double vision. You have facial nerve. That's cranial nerve number seven, which is both sensory and motor. It's mixed. Sensory and motor. Facial nerve. It passes through the stylomastoid foramen. The motor portion of this nerve supplies the face muscles of the face, scalp, the buccinator, the platysma, and so on, along with the motor control of the submandibular, sublingual, and lacrimal glands. The sensory portion of the nerve carries sensation for taste from the anterior two-thirds of your tongue and the palate. In most conditions, when this nerve is affected, um, uh, you'll have a condition called Bell's palsy. You get paralysis that results from an infection or inflammation on the nerve as it passes through the facial canal. This will result on pressure. This pressure on the nerve will result in a paralysis of your facial muscles. It can be like drooping of the face. Most of the time, it's unilateral. Uh, um, then you have the vestibular cochlear nerve. That's cranial nerve number eight, which is sensory. That passes through the internal auditory meatus. There's two parts: the vestibular nerve for equilibrium and the cochlear nerve for hearing. Sometimes people can get lesions. Most of the time, they're tumors or cysts on or near this canal, which can result in tinnitus, which is like a ringing or buzzing in their ears, or an impairment or loss of hearing. And they can also get a loss of balance, which would be vertigo, which we talked about in prior weeks. Then you have the glossopharyngeal nerve, which is cranial nerve number nine. That's both, once again, sensory and motor. It's mixed. Okay, it passes through your jugular foramen. Its motor function is to a small muscle of the pharynx, the parotid gland for saliva. Okay, its sensory function is for sensation of the pharynx, tonsil, and posterior one third of the tongue, for blood pressure within the carotid arteries via the carotid sinus. Now, since cranial nerves number 9, 10, and 11 is so close together, usually if you have damage to 9, it exhibits damage to 10 and 11. In other words, it's very rare to find impairment to cranial nerve number 1 by itself. They're so close. Normally, damage to cranial nerve number 9 would result in loss of taste from the back of the tongue and possibly an abscess and gag reflex. Excuse me. Then you have the vagus nerve. That's cranial nerve number 10. That's both sensory and motor. That's mixed, once again. Passes through the jugular foramen. It passes through the neck to the carotid arteries, which travel down together through the esophagus, through the diaphragm, and into the abdomen. Okay, it has control over voluntary muscles of the pharynx. Okay, vocal cords, your heart. It can also slows down your heart rate. That would be a part of your parasympathetic division of the autonomic nervous system. Okay, and then it also can affect your lungs and digestive organs. Um, in your fight or flight, excuse my French, but when they say you're scared shitless, that's what happens. Damage to this vagus nerve produces palpitation, which would be like a tachycardia, a forcible, a rapid beating of the heart. And then you have bradycardia, which would be a slowing of the heart. Okay, one is the sympathetic and one is the parasympathetic. The parasympathetic, okay, would be for the bradycardia, and the sympathetic, okay, would be the tachycardia. All these things can induce vomiting. Like I said, slowing of respiration and a sensation of suffocating and possibly paralysis of the vocal cords and pharynx. Then you have accessory nerve, which is the cranial nerve number 11. That's motor. It passes through the jugular foramen. It has motor control over muscles of the pharynx, palate, sternocleidomastoid, and trapezius muscles. Now, if this nerve is damaged, paralysis of the sternocleidomastoid may result in producing weakness and turning of the head in opposite directions. Okay. Also, paralysis of the trapezius muscles. Okay, can be drooping of the shoulders outward. Okay, that would be a damage to the paralysis of the accessory nerve, which is cranial nerve number 11. Then you have hypoglossal nerve. That's cranial nerve number 12. That's motor. It passes through the hypoglossal canal. It supplies the muscles of the tongue, the thyroid cartilage, and the hyoid bone. Damage to this nerve causes unilateral paralysis of the tongue and atrophy of that side. So it's going to happen on one side. Unilateral meaning one, not bi meaning two. So when the tongue protrudes, it deviates to that paralyzed side. And because of the unopposed action of the normal half, when it's retracted, paralyzed side rises a little higher than normal. So the tongue is like this. One side is almost inverted, one side is higher, which makes it very hard to chew, masticate. Okay, and it's also is swallow, which would also affect your larynx. Okay, because your larynx can also deviate to one side, and that would affect peristalsis during swallowing as well. Um, Now remember, cranial nerves are both motor or sensory, okay, or either sensory or motor, or they're both. Okay, you have your trigeminal, okay, which is cranial nerve number 5, okay, which is sensory and motor. Your facial, cranial nerve number 7, which is sensory and motor. Your glossopharyngeal, okay, which is cranial nerve number 9, sensory and motor. And you have your vagus nerve, okay, cranial nerve number 10. That's sensory and motor as well. That deals with your fight and flight and your autonomic nervous system and your parasympathetic, okay. Thank you for listening to my presentation. I hope you found this information useful. You'll be able to use it in your professional career, in your personal lives, and you can it's where it's applicable as necessary. God bless you and have a wonderful evening. Thank you.